So this position is hip extended and knee flexed, right? Right? Okay. So we've got two options here. We can do a knee flexion activity here in a couple of different ways. We can either do like a multi-angle isometric where I ask her to hold with some flexion here, and then I can move her, hold here, hold, don't let me move you. Who's got the camera? Thank you. Hold, don't let me pull you up. Pull into my hand here, please. Pull into my hand, there we go. So what I'm asking her to do is work the knee flexors, but now the hip is in a position of extension, right? And we can do the opposite by having her do some hip extension with the knee in a position of flexion, and we can basically do that by having her do a small bridge. So we can get the leg in a position where the knee is flexed, and what I'm asking her to do here is some hip extension. So it's going to be a little harder to do this in a purely isometric way, but what I can ask her to do is lift up the butt from the bed. All right? And again, what I'm asking her to do is isolate out the hip extensors with the knee in a position of flexion. And the reason why this is challenging is it is farther outside of the synergy patterns. So it's going to be particularly hard. Now again, what I can do here if needed, and I'll show you this when we do a regular bridging exercise in a moment, I can help to lift up her backside and change the position to get the multi-angle piece. The one thing that, that my patient did, that almost every patient will do, go ahead and do that bridge again, is she's pushing really, really hard on this side. I don't want her to do that. So I'm going to take this leg out of the mix and say, do that again, just the bridge with the right side, please. So, and you can see how much more difficult that is to do, right? So, but you want to think about what you can do to adjust accordingly, okay? But you can follow the same principles. Now for the bridging activities, let's scoot all the way onto the bed. For the bridging activities, okay, you guys know what a bridge is, right? Basically, now we've gone from a strictly unilateral activity to a bilateral one. So again, we need to be a little cautious. If one limb is substantially stronger than the other, then we're going to end up with some amount of asymmetry, and we don't want that. Again, my position of choice is this one here, with my legs straddled around my patient's feet. I'm not kneeling on her feet, but sort of my VMOs are right along the lateral borders of her feet, which gives me some element of control. Also keeps them from sliding down if her leg ends up wanting to go into a position of extension. So again, what I might do here, if she can do a good bridge, that's great. So show me that bridge. Excellent, right? So piece of cake, that's easy. Now if I have her take the arms out of the mix by putting her arms up across her chest and ask her to do that again, why is this harder?
Narrow base of support.
Yeah, a couple of reasons. One is because you end up sort of stabilizing, but also if you have your arms down, you can end up using the upper spine extensors to help you lift up, right? This way you're focusing the work on the lower part of the trunk. But it makes it substantially more difficult, right? So again, if I need to, I can be in a position where I can help her up and now say, hold still, hold it, okay, come down a bit, right, hold it there, hold it, come down a bit more, good, hold it right there. Now come up again, I want you to ease it down slow, all the way down to the bed, very good. If I need to be in a different position for that, I can be alongside, and I can still have, in this case, my right leg on her right foot to keep it from sliding out, and again be in the position here to lift the backside. I would only do this if my patient can give me some element of symmetry. If the person ends up really pushing only with their unaffected side, then they're not really ready for an activity like this. Now that said, if they can't give me symmetry, I can take this leg out of the mix and ask her to try to do it just with the right leg. But again, it will be much more demanding, but it will at least make sure that she focuses on this right leg. All right. One more activity that I want to show you, and it's a little bit of a turnaround. This is a bit of a progression. Now, up to this point, all that we have done at the leg is work on drawing the leg up or breaking out of the synergy patterns by having the hip and knee in their off positions. But functionally, we use the leg in an extended position. So we need to think about starting to get those extensors to work in a smooth and coordinated way without overworking. And here's the exercise we're going to do for that. We're basically going to do a placing activity for the hip and knee extensors. Remember, the first placing activity we did was for hip and knee flexors, right? Her action was always a drawing up action, where the resistance was always a straightening resistance, right, either gravity or mine. Well, here we're switching. I am going to be providing a flexion force against her leg, and she is going to be resisting with her extensors. Okay? So we start with a multi-angle isometric. Now we do need to be a little bit careful. If all of the pressure is on the ball of the foot, it could trigger that plantar flexion response, and I don't want to do that. So I tend to think about getting that whole foot into like the crook of my arm here, so there's pressure distributed all along the bottom of the foot. That will minimize that clenching up. Now again, if she's in this position and I push, there's not really any muscle activity happening because the leg is locked straight. It's not, so that this is not any effort happening on, there is not any effort on her part. But once I add a little bit of flexion, and now I load onto the leg, it's bending the hip and the knee. So her job is from just a teeny bit of flexion is hold still, don't let me move you. And I'm pushing straight up towards her hip. If she doesn't resist, relax that leg. I'm going right towards her ankle, right towards her hip, which is going to flex the hip and the knee. Yes? So hold still, don't let me move you, hold here. And again, for this patient, it's a very small amount of pressure. What I'm trying to see is that she can contract the hip and knee extensors without also plantar flexing into me or trying to adduct. It's got to be controlled. A little more flexion, hold still, don't let me move you. A little more flexion, don't let me move you. If she can do that, then we go to the eccentrics. So again, I sort of start with a little bit of pressure, hold it there, now ease it up slow. Don't let me push against you. So again, I am pushing that way. She is resisting that movement. Okay, now gently, I want you to push me away. And now she's doing a concentric against my resistance. Again, if your patient is pushing you very hard, then this exercise is too easy for them. If they are pushing and they're using the synergy pattern to do it, then this exercise is too hard for them. And we need to think about something even easier first. Okay? So just did a couple of things. We did the exercises with the hip extended and the knee flexed, did the bridging, and then we did the hip and knee extension. We've got just a couple of minutes left to practice. Please do so.